Let's go to our poly panel now. Liberal MP Tim Wilson from Labor, Peter Murphy. Thanks both for your time. I know you're both there in the town of lockdown, so let me ask you this first of all. Peter Murphy, do you agree with Bill Shorten that we need a quicker path out of this and he hopes it's the worst case scenario, or do you agree with Richard Marles that the course outlined by Daniel Andrews is the right one?
I agree that we have to have these decisions based on the best medical evidence. Of course, everyone wants to get out earlier and as soon as possible, and the Premier wants us to get out as soon as possible, but he also wants to save lives, and that's what I want. And overwhelmingly, that's what my constituents want. They want some support for their businesses, they want some support for their income, they want more support from the federal government. They want to get out of lockdown as soon as they can, but they're willing to do what has to be done for the health and well-being of not just their own families, but of other people.
So everything on medical evidence, we've learned, though, that the curfew is nothing to do with health advice. It was a separate decision, a political one. What do you make of that?
I haven't heard whatever comments you're referring to. My understanding
We've heard them now. What's your opinion?
Was that, well, Jim, if you just stop interrupting me, I could finish my sentence. My view of the curfew has always been that it was to stop people from moving around unnecessarily, and that's one of the greatest sources of spreading the virus, and we've seen that happening in the workplace.
Right. So yeah, it was implemented according to Daniel Andrews. Yeah, I'm going to clarify that point, Tim Wilson. So Brett Sutton said this was not his advice, so this wasn't health advice. He has said that he believes it was in place to enforce measurements, but this was not health advice. So what do you make of the curfew as a result, Peter Murphy?
Well, I think that people shouldn't be moving around and should only be leaving home for the essential reasons to leave home. Now,
but they're the rules anyway.
Aren't essential reasons to leave home unless you are working or need medical attention in the evening. I think that we just need to do whatever we can to not be going in and out of restrictions. We've seen in other countries, we've seen in the UK, you know, that massive spike that they've had in the last few days, and now they're going back into more social restrictions. Right. And we want to deal with this and get on with life.
Tim Wilson, should the curfew be lifted?
Well, it's quite clear that it's not informed by health advice. And you've outlined that. Brett Sutton has now outlined that. And so I think the only measures to be in place are those that are necessary to protect public health. And it's clear that that isn't the case. It's a political decision and a resource management decision. I mean, we're not here to be slaves of the state. We are free people, and I don't think it's justified. I've been in Canberra, Tom, for the past month, obviously to federal parliament, and one of the things that's become very obvious is how much people's mental health has deteriorated in the month between when I left and when I returned. And that's just not in my community. If I speak to other colleagues, they're reporting exactly the same thing.
So Brett Sutton said it wasn't his advice. He went on to say that on balance, he would probably adopt it without being committal to it. You're saying, let's just be clear on this, lift the curfew right now, as soon as possible.
What I'm saying, is if it is not backed up with medical advice, it's not backed up with health advice, it's not the basis in which the decision was made, it's purely based on other reasoning. Now, we need a very clear explanation about what that reasoning is, because it's really not health. And that is the basis in which...
So if the advice didn't... Right, so if the advice didn't come from Brett Sutton originally, but he endorses it, would that be good enough for you or not?
Well, I actually want a basis of reasoning. I think every measure that is taken to be justified on the basis that is necessary to deal with the containment of this virus. When a Premier uses political whim to make decisions where it isn't backed up by a scientific evidence, where it isn't justified, then you're needlessly suppressing the freedoms of people to be able to go about their daily lives.
Well, on that basis...
And with huge consequences, let's make it clear. Mental health consequences, delay of elective surgery, unidentification of other health conditions, with big, short, medium and long-term health consequences.
Well, undoubtedly. But I take it, as I said, that Tim then supports other decisions that have been made on medical advice. I just...
Well, we can go in a long discussion around proportionality.
What people don't need at the moment is politicians, including the Prime Minister, using what's happening in Victoria as an opportunity to make political point scoring. What they want is leaders who are going to say, I'm here to help, and this is what I'll do to help you get through it. I'll put
That's
more
right, but
money
that doesn't
into
come on the
mental
basis
health.
that
They need a
they
Prime
beat
Minister
into
that
submission
says...
Victorians against their capacity to live their lives. We've had Bill Shorten now saying that this is wrong. Well, you talked over me, so I'm talking over you.
No, I didn't.
Bill Shorten has now said that he disagrees with these measures.
Okay, just keep talking and don't let me talk. That's fine. Okay, so what we need is a Prime Minister that says, I know that Victorians are struggling. I know that businesses need JobKeeper to continue. I know that workers don't need the rate of JobKeeper to be cut. There's time for recriminations later, but I'm going to show true leadership. And instead of having a political go, I'm going to do what I can to help Victorians get through.
Okay,
That's what people
Peter,
want at the moment.
The decisions right now are having an impact. Let me ask you this then. Epidemiologists say they were not asked to model different outcomes in terms of, when you could lift restrictions and how much that would likely affect further outbreaks in the future. They weren't asked to model different outcomes if contact tracing actually improved. And yet Daniel Andrews made announcements yesterday that should improve contact tracing. Why not at least have those other outcomes modelled so that if the contact tracing improves, you can open up the economy earlier?
Well, I hope contact tracing does improve. I hope the COVID Safe app proves to work at some point.
It does.
When we're talking about
this is a gross, dishonest lie on behalf of the Labor Party. It has been, it wasn't used in Victoria, Peter Murphy, by the Labor government. It has been used in New South Wales as part of the contact tracing
system. Of course it's been used. It's
which is why it was used in New South Wales. It wasn't used initially in Victoria at the period where we saw this massive outbreak. This dishonest disinformation put forward by yourself and other Labor members of Parliament are costing lives, and you should know better.
That's outrageous.
No, it isn't outrageous.
Yelling doesn't make a point.
The complete failure of contact tracing, the failure around hotel quarantine, the failure and the fact that you are running interference for the state government and its failures to enable them to continue to cock up at the expense of the Victorian economy, Victorian mental health, Victorian lives is disgraceful.
All right, Tim, you came on here to yell and to carry on.
No, I came on here to hold you to account.
Have a discussion about
so you've run interference
and how we can help Victorians get through the crisis that we're in at the moment. That's what I'm interested in,
them and
in being constructive and saying that we need the COVID Safe app to work. Everyone hopes that the contact tracing means that we can get out sooner. And what we need to talk about now is the support that Victorians need. And you've pointed to mental health.
We've only got a few seconds left.
Putting more money into mental health.
Let me just ask you this, Tim Wilson. Could the COVID Safe app be working better?
Well, every single system within our government, our society could work better. But I'm sorry, Peter Murphy has just misled the public in what he said.
I'm just asking a question, though. We're nearly out of time.
No, but the COVID Safe app does work. No, could it work better? Sure. It wasn't used initially by the Victorian system when we saw the massive outbreak. It has been in South Wales, used in New South Wales, which is why we've seen a situation of containing health impact.
I sense we'll be picking up this conversation again next time. Tim Wilson, Peter Murphy, thank you.
Thanks.